mentioned, Todd's been a huge asset to the chamber for a long time. He's the vice president of employee benefits and an employee benefits consultant with McGriff Insurance. He's been with McGriff through a few mergers since 2003. But before McGriff, Todd started working for Mutual of Omaha right out of college in 1987. He's been in the group insurance market for 33 years and is just a wealth of knowledge. I mentioned that he's been a great friend of the chamber for a long time, and it is. I don't think we've done a lot of topics here. We've had a lot of webinars we've worked on, and I think this is one of those that sort of gets overlooked, but it is so important. And I'm really excited about some of the things that he's going to talk about today. So Todd, with that, I'm going to turn it over to you, and we'll get started.
Guys, good morning. I am Todd Deleski with McGriff Insurance, and it's my pleasure today to go through and talk to you about the benefit changes that have taken place since the two acts were announced here early in March. So before we get into it, quick little disclaimer. This presentation is intended for just general information. I'm not giving any legal or tax advice. But again, as Jimmy said, if you have questions afterwards, feel free to reach out to me. I'd love to address your questions one-on-one, or I'll stop a couple times today and answer those questions there. But again, this information is just general information. I'm not giving you tax, legal, or medical advice, but anyway, attorneys now are happy. So what are we going to talk about today? I'm going to first talk about the Family First Corona Relief Act and the different mandates and how it affect our employee benefits. Then we'll address the CARES Act. And again, in the CARES Act, there's more health plan changes. They address some retirement changes. And all these changes they're easing the rules. So they're really positive changes for both the employer and the employee. So I can't emphasize enough. Congress has done a great job to get us through this emergency as painless as possible. It's going to be painful, and it has been painful, but they're doing their best. We'll talk a little bit about Section 125 and your cafeteria plans, how the rules have been eased around flexible spending, health savings account, and even HRAs, health reimbursement accounts. Then we'll talk about virtual medicine. Telehealth is becoming more and more popular. The rules were eased there. And then I'll get into kind of some of my go-to topics whenever I do employee meetings. We talk about insurance carriers, their online and their mobile access, and how we can get more information at our fingertips. My favorite topic, we'll talk about prescription drugs and how I can help you save some money, just making little changes in the way we buy our drugs. And then the last couple of topics, we'll talk about COVID-19 and some of the possible cost impacts. And then some planning for the employers as we go back to the new norm. What should we look forward to? What should we expect? We'll talk about that in closing. Again, guys, if you have any questions, shoot Jimmy a note. I'll stop every 2 or 3 slides and see if he has any questions that I can address, or we'll have plenty of time at the end, I promise. So the Family First Act was signed into law on March 18th, and it took effect April 1st, and it's going to run through December 31st. So only the mandates that I talk about today are at least here to stay through the end of the year. Who knows how quickly the recovery, how quickly we're going to get back on our feet. It could be extended beyond that, but so far they're through December 31st. These apply to all private employers with less than 500 employees. Small employers can exempt themselves. If you have fewer than 50 employees, you can exempt yourself from this act. I'll explain in a minute. This is important, guys. All employers must post the Family First Coronavirus Response Act. So the Department of Labor is taking it easy on us. You can post it either at an intranet site. You can electronically send it to all your employees, or you can do the old-fashioned way and just post it in the Commons area. But we must post that act. So keep that in mind. That's important. The Department of Labor mandates that. Now, the act provided, first of all, 2 weeks of mandatory federal paid sick leave for anybody that can't work due to the virus. And those 2 weeks, you get paid your normal pay. After that the act expanded the Family Medical Leave Act for another 10 weeks. During this time, you get paid 2/3 of your current wages. And this even covers if a parent is unable to work because the child's schools was closed, or their place of care is closed, or their child care provider is unavailable. So it allows additional 10 more weeks of paid leave at 2/3 of your wages. Now, I mentioned earlier, small employers were exempt if you have less than 50 employees. And the reason for that is if you were a restaurant and maybe you had 10 employees and 8 of them said, hey, I can't work because my child care is shut down, that business would really shudder. So as a small employer, you could exempt yourself from that act if it could cause harm to the health of your business.
Spot. We do have a question that I think that hopefully you can ask. What is the process to exempt our company from this act?
Believe it or not, you just got to have a documentation and put in your file and tell your employees. Just in case you ever get audited, but the government is not asking for anything, they could not handle all the paperwork. It's a very simple process. Next, we're going to get into the healthcare mandates and what changes in your healthcare. So, Family First Act was effective March 18th, and one of the first employee benefit changes, the act says that all COVID-19 testing and related services will be paid 100%. Now, this applies to fully insured medical plans. It even applies to self-insured medical plans. Grandfather, non-grandfather plans, church plans, non-federal government plans, so that would be state and local plans, and then also individual and student health plans. When I say individual, I'm talking about exchange plans or just individual medical plans. So the act said that all your testing related services will be paid 100%. This also includes antibody testing. I think we're going to, as the government and as the FDA approves more of these antibody tests, we're going to see more and more of these. So they're going to be paid at 100%. The cost to administer the test will be 100%. The office visit that's related with it will be paid 100%. Whether you do it through drive-through at CVS, go to the emergency room, go to the hospital, they're going to be paid 100%. You don't need any prior authorization from your healthcare professional. All you need is authorization from your doctor, and it applies to both in-network and out-of-network place of service. So again, this is all testing will be paid at 100%. After the government said, hey, we want you guys, insurance carriers, to pay the testing at 100%, many major medical carriers said, fully insured carriers, that hey, we're also going to pay for the treatment. I know Anthem, Humana have both come out, notified their employees, their insured, to say, we're going to pay for all the treatment, regardless if it's emergency room, inpatient, outpatient, virtual medicine, office visits. In any setting, we're going to pay for the treatment, both in and out of network. Now, self-insured plans can choose to cover the COVID-19 treatment. The testing had to be covered at 100% by self-insured plans, but the treatment, it's up to each company whether they want to treat it at 100% or not. And I'm seeing about 50-50. A lot of my larger carriers, larger clients that are self-insured are saying, sure, we'll pay the treatment too. When we get to the end of the slide today, I have a model that we put out of what we think the cost of COVID-19 treatment might cost an insured. So we'll go through that and you'll get an idea of what it takes to get that covered at 100%. All right, so this act was signed just 9 days after the Family First Act, so Congress moved quickly. This is the act that included the one-time payment to individuals and then a $500 additional payment if you have dependents. It also strengthened unemployment insurance. What this act did is added $600 a week to the unemployment insurance. There's been some controversy around that. We're going to get on today, but again, it increased the benefits $600 a week. It also provided some additional healthcare funding in the forms of loans and grants to pay for healthcare as well as payroll to defer layoffs. So we hope to keep America employed, and this was one way the government said they're going to do it. Now, within the CARE Act, they did alter some other employee benefits. We'll go into that health as far as health coverage. retirement savings, even some student loan assistance. The first act, first healthcare provision change under the CARES Act is they said there'll be no cost share to members for telemedicine, teledoc, any virtual medicine visits, including people that are on high deductible health plans. Now, as you can recall, high deductible health plans are plans that allow you to participate in a health savings account. High deductible health plans cannot have first dollar benefits, so you always had to meet your deductible before any benefits were paid. Well, in the CARES Act, they said, we're going to scrap that, and we're going to say, if you see a doctor through telemedicine, we're going to allow the high deductible health plan to pay 100% of that visit. The reason for that, guys, is they want people to stay out of the doctor's office, out of the hospitals, so we don't continue passing along with COVID-19. They want to avoid the doctor's office and emergency room unless it's COVID-19 or it's an emergency. The telemedicine going forward is paid at 100%. The Act also allowed over-the-counter medications, menstrual products to be paid through your FSA, your flexible spending account, your health savings account, or your HRA. And this regulation went into effect retro back to January 1st, 2020. So if any of you guys have a flexible spending account, an HSA, or an HRA where you went and picked up some over-the-counter medications, it could be as simple as aspirin. If you can find those receipts, services rendered after January 1st of this year, you could apply it to your flexible spending and get reimbursed. What Congress is trying to do is they know there's a lot of care that's going to be avoided or skipped, elective care, dental visits, vision visits, just because places are closed down. So they're trying to give you more ways to use your flexible spend dollars and not lose it at the end of the year. Most flexible spending accounts you can carry over $500, so there's a way to not lose it. But if you put out $1,000 or $2,000 because you thought you were going to have a knee replacement or elective procedure, but it's been put off because of facilities closed, we're trying to find ways to help you use that money. And then again, on the CARES Act, it reinforced that the testing for COVID-19 will all be paid at 100%. Now, I think ultimately, when we do come out with a vaccine immunization, they'll also be paid at 100%. The ability to leave that open to interpretation a little later. So that's, again, we're all trying to help us all. As far as retirement plans, there's some special coronavirus-related distributions. So if you're a qualified individual because you're either diagnosed, a family was diagnosed, or you have some financial hardship, you can take out a distribution. They're not going to penalize you the standard 10%. And they're only going to hold 10% withholdings instead of 20%. So they're giving us a window to pull some money out of our 401k or our 403b out of retirement plans without being penalized like we would today if you're less than 59 and a half years old. That act also loosened up some loan provisions that let you get a larger portion of your retirement plan in a loan as long as you take the loan out within 180 days when the act went into law on March 26th. Also, required minimum distributions if you're 70 and a half have been suspended. So that's good news. If your retirement plan is going to adopt these provisions, you do need to make an amendment. But believe it or not, the amendment does not have to be made until January or to December 31st, 2022. You have plenty of time to amend your plan if you're going to let some of your employees take advantage of some of these requirements. And then lastly, the CARES Act amended ERISA to postpone some final deadlines. So if your 5,500 is due right now, they're giving you some additional deadlines so you don't have to deal with that while we're trying to keep the business open and things afloat. Another portion of the CARES Act is a student loan repayment. Certain student loans can be repaid by your employer for employees, which will be tax-free to the employee. The maximum amount that can be forgiven or repaid is $5,250. The repayment must be made between now and December 31st. and then the employer can pay the employee or the lender the amount that they're going to help them repay on that student loan. Just another way to kind of ease some pain for American citizens. All right, Jess. Let's talk a little about the Section 125 and how the CARE Act eased some of the rules there. So I mentioned earlier, over-the-counter medication, menstrual care products can now be purchased using your FSA card. It goes back to January 1st, 2020. You don't need a prescription for these items. In the past, if you wanted to pick up fish oil or aspirin and they're over the counter, you had to have a prescription on file from your doctor saying, hey, Todd needs to take fish oil every day for his joints and his heart, and then you could do it. Well, today, you don't need a prescription any further. You can just simply purchase those items and submit them through your flexible spending account. I mentioned earlier your debit card. You probably won't be able to use your debit card right away just because the debit cards and the systems haven't been set up, but you can ask for manual claim reimbursement. So simply submit the receipt to your FSA administrator, and they'll be able to cut you a check or a direct deposit into your bank account. You can use those funds during this calendar year. Now, the CARE Act did not provide any other changes to the FSA, but there are some qualified life events that are taking place now that we need to think about. For example, if your child provider is not working because they closed down the child care, or they can't come to your home anymore because of personal reasons, you can stop your dependent care FSA elections right away. You cannot go backwards, but you can tell your administrator, stop deducting dependent care FSA, and they can do it right away. So that way, at the end of the year, you don't have too much money left over in your dependent care FSA and you're unable to use it. Remember, your dependent care FSA does not carry over from year to year, so you must use those funds in 2020. So if you're going to use it for a daycare coming up this summer, and maybe the daycare won't be open, or maybe you have some kind of camp, and maybe it's not open, you might consider stopping your dependent care FSA so at the end of the year you don't have money in that you can't use. Another thought is, in the fall, let's hope things get back to normal, but as we get closer to the school year next year, make sure our dependent care are going to be open, because again, we don't want to have extra funds left over. And we're always looking to the IRS for further guidance. I'm guessing there might be some kind of ease towards the fourth quarter if a lot of people are caught with extra money in the FSA and they can't do it now. Nothing's come out. That's kind of our forward thinking. So my disclaimer earlier was no tax teaching here. Just an idea. All right, Jesse. Jimmy, any questions before I get into telehealth?
No, sir.
All right. So, guys, I love this tool, and most major medical carriers have virtual health, telehealth. All you need is a phone with a camera on it, your laptop. You can simply dial up the doctor 24 hours a day, 7 days a week, talk to them. Most carriers, like I said, are waiving the member cost because of the CARES Act for COVID-19 diagnosis. But also, you can use the virtual medicine for things like pink eye, the cold, the flu, fever, allergies, sinus infections. About 70% of normal office visits can now be done for virtual health. So if you're not going to the doctor's office and you're using virtual health, there's a better chance of not getting infected with coronavirus that might be in the doctor's office. So Congress is really pushing this virtual telehealth. It's a great tool. I've used it myself. You simply call, talk to the doctor, they see you, and you tell them where you want the medication called in. If you need an antibiotic or you have a rash and you need some kind of cream, they call it in, you can go pick it up, and within a couple hours, you have treatment in your body and you're starting to feel better. This also works great, guys, when we're back to normal, when we're traveling on business, or we're traveling on vacation, you're down at the beach, and when your children aren't feeling well, you can dial up the telehealth right there from your cell phone and take advantage of that and get some medication, get back on your feet. So don't forget about this. It's a great tool. All right, yes. Another great, while I got your attention, we always talk about this in our open enrollment meetings with all our clients, is carriers have really got some great online and some great mobile access tools. Most carriers, Anthem comes to thought, they have an app called Sydney. You download to your smartphone, and you can get everything from ID cards there. You can view your benefits. You can search providers. Again, Telehealth is right there. You can look at your certificate booklets. So no need to carry an ID card in your wallet anymore. If you want to print an explanation of benefit, you want to submit it to your flex carrier, you can do it right there. So there's some great tools, some great discounts, some great services right there in your handheld. So take advantage of your carrier's tools and their mobile access. All right, prescription drugs. Guys, trend in prescription drugs is getting crazy. Back in 2014, about 10 to 12% of our healthcare spend was in pharmacy. Now it's nearly 25%, and it's rising. You know, when you get prescribed a specialty drug, they're very expensive. Even if you have a great health plan, it still might cost you $75 or $100 copay for a 30-day supply. I suggest you go out to the manufacturer's website and look for discount cards or copay assistance. These manufacturers are looking for market share, and they'll give you a great discount on these drugs, at least for the first 12 months. See here, 42% of prescriptions are filled using copay cards. So again, get familiar with the manufacturer's website, take advantage of that, go out there and see if your medication, if it's a specialty drug, it has a discount card, and take advantage of that. Another way to control your RX spend and also your employer's RX spend is ask your doctor and pharmacy to fill generics whenever possible. You know, generics are very similar to brand names. Maybe the time release is a little bit off, but the price, there's no comparison. Generics going to save you your copay on your health insurance plan. Also, the cost to your employer is going to go down. Now, talk to your doctor first, because if your doctor writes DAW on the script, dispense as written, then the pharmacy has their hands tied and they can't substitute it. So ask your doctor the next time you get prescribed a medication and say, hey, doc, we'll try generic. Maybe he or she will suggest that, yeah, let's give it a shot. As long as the outcome's the same, we might as well go with generic. So just keep that in mind. And again, ask your doctor so he doesn't write DAW so your pharmacist's hands are tied. Another great tip we tell everybody during open enrollment is using your mail order service. You can get a 90-day supply of your maintenance medication, mail order to your house. Typically, you pay 2.5 times the copay, so you're saving one copay or half a copay every 90 days. And it's convenient. And if you're at the office and you're just taking your last supply on Monday, you don't have time to run to the doctor or get it filled, you know it's going to be at your doorstep. So take advantage of the mail order service. It's a great tool. Any type of maintenance medication, whether it's cholesterol, blood pressure, take advantage of it. Then lastly, pill splitting. This is becoming more and more popular. So let's say you're taking 40 milligrams of something and the manufacturer makes the pill. Now you can't do this with capsules, it has to be a pill. Let's say the manufacturer makes the pill into 80 milligrams. You can ask your doctor to prescribe 80 milligrams of that medication, and you can cut them in half, and that would be the 40 milligrams you need each day. Check with your doctor. Talking about pill splitting, there's even tools out there that help you split that pill perfectly so you don't have to worry about not breaking it evenly. So talk about it. It will save you a copay every month. All right, I mentioned earlier we have some cost impact projection tools. This was designed by our actuaries here at McGriff. That's going to walk you through and just kind of give you an idea of what we can expect. So the first column there where it says current, and this is the true client of about 2,000 employees here in Georgia. Their current annual PE per PM is per employee per month. We projected $676 a month per employee per month. Now, with COVID-19 here, low impact of the COVID-19, we think their cost is going to go from $676 to $683 per employee per month. So we project about $68 more of a cost because of COVID-19, but then we also project a $61 savings per employee per month because of all the care that's going to be avoided. And this is amazing. We think of all the care that's going to be avoided, about 25% of that will either be delayed or not rescheduled. So that's elective procedures, that's routine office visits, dental visits, vision visits. So think about this. If you're going to have a dental care done in March or April and your doctor's office is closed and you postpone that, you're going to push that out 3 or 4 or 5 months. You'll get back on schedule, but you'll never recoup that one because you can only get a dental exam every 6 months. So we think there's going to be a lot of care that's going to be avoided to offset some of the COVID-19 costs. If your company had moderate impact, we think the projected increase is going to be $136 because of COVID-19. When we say moderate, if it goes longer than 2 months, and then the avoidance is going to be $107, so you're going to see the increase there. And then if this goes through the summer, we have a high impact. It's going to be $204 per employee per month of the impact because of the COVID-19 testing and treatment, and we're going to avoid $142. So in this client's best case scenario, we say their cost of healthcare is going to go up by 1.1%. In the worst case, we think 9.2%. I know we all read about there, this is going to be increase our rates by 40, 50%. Well, we don't think that's true. We think there's going to be an impact, but again, with all the avoidance, the LASIK surgeries and things of that nature that are going to be avoided, there's going to be a lot of care that's going to be saved as well and put off or just not rescheduled in the near future. All right, guys, we're getting near the end. We think this is important, some post-COVID-19 planning, things to consider when we get back to our new normal. First of all, working from home, WFH. What worked well? What didn't work? I think we all need to sit down and analyze that and decide what we can do. If something like this does come back in the fall, how can we be better prepared to get our employees working at home and working as productive as possible? I think we all get back to the office. There's going to be a great surge of vacation requests. People have been working at home. We've been locked down. When we get back out, the beach is open, travel plans get together. There's going to be a great surge of vacation requests. So we got to use it by the end of the year. So keep that in mind. Make some whatever necessary adjustments you need to make so your business can function during this time of great vacation need. And then ease your office back to normal. I know your first day back, it's not going to be business as usual. We're going to be taking our equipment back home. We're going to be getting organized. It's going to be your first day back in the office. For a lot of us, it's like going to be a celebration. We haven't seen coworkers for 4 to 6 to 8 weeks. So ease back to it. And then once things get back to the new normal, there's going to be some great work to be caught up. We're going to have some hectic schedules. So just remember that. Recognize your employees going forward because, again, this has been some tough times for all of us, employers as well as employees. So I think it's time to recognize and sanitize some of our employees when we do put this extra effort going forward when we get back to the workplace. Peace of mind resources. Just make sure you communicate with your employees, your EAP program, and other stress management resources. Because again, this has been tough for all of us. We're going to get together. We're going to get through it together. But the employee assistance program and other stress management tools can really come into help, as well as financial well-being. This has been a burden on a lot of us. Less income, lower hours work. So we need to work together and help your employees get through this burden. Additional resources. You can always go to our website, McGriff Insurance, and find some additional resources, find information about the CARES Act and about the Families First Act. Of course, the CDC has some great information on how to prevent further outbreak and the other organizations here. So with that, Jimmy, I'll turn it over to you and questions. And guys, thanks for this opportunity. I appreciate it.
No worries. Thank you, Todd. That's great information. Todd, one thing that I don't think that people know much about is the program that the Georgia Chamber has promoted through Anthem that chamber members can take advantage of for insurance discounts, the Chamber Smart Plan. Will you talk a little bit about that?
I'd love to. So Chamber Smart is what Anthem put together in the state of Georgia. And if you participate, if you're a member of any chamber in the state of Georgia, you can participate in this plan. It is for groups of employers that have less than 50 employees. And what it does, it helps the group get around the Affordable Care Act. As you recall, the Affordable Care Act says if you have less than 50 employees, you're going to be community rated. Plan designs are going to be what the plan designs are, and you're going to lose a lot of flexibility. Your rates are going to be based on the community that you live in, not on your individual employees. What the chamber did with this Chamber Smart Plans is they allow employers to come together, get into like an association, and you get rates based on your current population and the health of your employees. So if you have a young workforce and you're healthy, you can really benefit and find yourself in a situation where you can save a lot of healthcare premium by joining the Anthem Chamber Plan. It's a great plan. It's been in effect for 2 years. The first renewal last year, I'm happy to say the increase was 1.9%.
How does that compare to typical increase?
1.9%. That's just incredible. So let's hope that continues. Because again, they're banding together the young, healthy groups and make it into association.
Now, what would the folks on the call who are not involved with the with that plan, what would they need to do to either get more information or just to start the process of seeing if it's a good decision for them?
Maybe they can get my information from you or Jesse. Send me an email, give me a call. We can talk more about it, find out what kind of situation they're in. And it's simply just gathering their employees' information and getting quotes and comparing that to their employer's plan. But we'll be happy to help them.
Okay, very good. Before we wrap it up, if anybody would like to ask a question individually, feel free to unmute yourself and your mic, announce who you are, and ask the question. While we give folks just a minute to do that. Todd, you mentioned the FSA program and cards. Just hit the highlights on that one more time because I think it's very important for folks because I know me having 2 young kids at home. It seems like every year I decide that, if I decide not to do the max, I always regret it, or 1 year we don't quite use enough, and then the next year. Talk a little bit about that again in terms of what they can do today to change that if they need to.
Sure. So there's on a flexible health plan, there's two portions. There's the health side and there's the dependent care side. On the health side, what the CARES Act did is allow us to buy over-the-counter medication, aspirin, supplemental fish oil, things of that nature without a prescription to use your flexible spend account dollars. Remember, at the end of the year, only $500 rolls over to the new year. So take advantage of that. You can get Band-Aids, any over-the-counter type medication. You can use your flexible spend dollars so you don't lose that money at the end of the year. So on the dependent care side, if your daycare or your provider is not working, you call your flexible spend administrator now and stop your payroll deductions. Because if you don't have a provider to spend that money with, the money will go to waste. So they've opened the rules and said you can now stop your dependent care. The IRS typically says you cannot stop it unless you have a qualifying event, adoption or birth. There's 13 of those. But this is one exception they made. So take advantage of it, please.
Excellent. Well, before I let you close this out for the program, I appreciate you for coming on today. I appreciate everybody who's on the call. I think it's a lot of great information, stuff that I would think, I said earlier, maybe gets overlooked, but is so important. And for some of us who may feel stuck because you don't think that you can change either the dependent care or some of those deductions. that you talked about. It's important for everybody to know that. So is there anything that you would like to leave us with before we close out?
Just as testing becomes more and more available to us, as CVS ramps up, I know in some states, I know Massachusetts, CVS is drive-through testing. Take advantage of that. No co-share to you. It's paid 100% by your fully insured plan. Take advantage of that because testing is really the way we're going to get out of this national emergency. Thanks,
Awesome.
Denise.
Well, very good. Thanks, Todd. I appreciate everybody for being on the call. If you have any questions about the Chamber Smart Plan and want to get more information for that, you can email Jessie Martin. Her contact information was in the reminder, or you could contact me. My email is jlane, that's JLANE at focochamber.org. Feel free to reach out to me as well, and we'll get you what you need. With that, thank you, everyone. Have a great day. Stay safe, and we'll see you soon.